FlashMed. Rituximab plus lenalidomide in advanced untreated follicular lymphoma. This study was published in the New England Journal of Medicine in September 2018. This was a phase 3 trial to evaluate rituximab plus lenalidomide, as compared with rituximab plus chemotherapy, in patients with previously untreated follicular lymphoma. Patients were randomized to rituximab plus lenalidomide, as compared with rituximab plus chemotherapy. Treatment with rituximab plus lenalidomide consisted of 18 cycles of the two drugs, followed by rituximab maintenance therapy every 8 weeks for 12 cycles. Treatment with rituximab plus chemotherapy consisted of the investigator's choice of one of 3 regimens, followed by maintenance with rituximab every 8 weeks for 12 cycles. A total of 1,030 patients were randomly assigned to receive rituximab plus lenalidomide, 513 patients, or rituximab plus chemotherapy, 517 patients. The rate of complete response at 120 weeks was 48% in the rituximab lenalidomide group and 53% in the rituximab chemotherapy group. The interim 3-year rate of progression-free survival was 77% in the rituximab lenalidomide group and 78% in the rituximab chemotherapy group. The authors reported that 50% of the rituximab chemotherapy group had grade 3 to 4 neutropenia versus 32% of the rituximab lenalidomide group. The authors reported that 7% of the rituximab chemotherapy group had febrile neutropenia versus 2% of the rituximab lenalidomide group. A higher percentage of patients in the rituximab lenalidomide group had grade 3 or 4 cutaneous reactions, 7% versus 1%. The authors concluded that both treatments followed by maintenance rituximab had similar efficacy in untreated follicular lymphoma. The safety profile differed in the two groups. Thank you for watching.